Good afternoon. Welcome to the City of Toronto's COVID-19 media briefing for Monday, April 13th, 2020. With us today, Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and General Manager of the City's Office of Emergency Management, Matthew Pegg. First up is Mayor Tory. Mr. Mayor.
Well, good afternoon, and thank you, Brad. This is the fifth week since we took action based on the advice of our public health professionals to effectively lock down our city as much as possible to stop the spread of COVID-19 and save lives. Protecting people's health, saving as many lives as possible, and limiting damage to the economy and to our way of life have been our focus through this emergency. And that is why we have been urging people to stay home as much as possible, to keep their distance from people when they go outside, and not to linger in parks or public squares or to gather in groups. I know the restrictions put in place have been tough for people and unusual in the Toronto context, but I also know that the vast majority of people are getting the message and they're doing the right thing. And I want to express my sincere gratitude to those who have complied and who continue to comply, the members of the public, but also to the police and bylaw officers who on some nice spring days presented themselves, let's be frank, as the purveyor of bad news, though for a very, very important health-related reason. Compliance did improve this weekend, and again, thank you for that to all the people that got on the program. But there are some people who still haven't got into this life-saving program that we are trying to convince people to be a part of, and some of them did get a ticket. Bylaw officers issued 107 tickets over the holiday weekend. That's more than half of the total tickets since we began with this set of laws and policies on April the 4th. Between April 2nd and 10th, the Toronto Police Service issued 2,526 cautions, 3 tickets for provincial offences, 4 tickets under the city bylaw, 88 parking tickets, and 4 tows. And so I think you can see that the emphasis in that time was very much on education and information. From Saturday up to today, the Toronto Police Service has issued 56 tickets for provincial offences and under the city bylaw, 6 parking tickets, and 623 cautions. So again, there's some increase in tickets here, but there's still a lot of education and warning going on to help people to get themselves better informed about the laws and why we're doing the things that we are. So between bylaw and police officers, some 348 tickets were issued, and while that really isn't too many, in a city of 3 million people, it is exactly 348 too many. Sadly, there are still some people who don't understand the simple message. Please stay home, stop the spread, save lives. And some of those examples of behavior from this weekend that really aren't acceptable in the context of what we're trying to do here include people continuing to rip down the caution tape that has been put up on the exercise equipment at Woodbine Beach, dogs running off leash at the western beaches, the covering on the basketball rims at Canoe Landing were removed and people were playing basketball, and people continued to congregate and ignore physical distancing rules in the Corktown Commons. Again, we're not trying to be killjoys. We're not trying to be people who are citing these examples because it is fun to do so. These are genuine places where it is possible that somebody could be taking part in these activities who unknowingly has the virus and has shown no symptoms, and if they're able to be in close contact with others, could spread that virus, as our doctor has told us so many times. People have to remember this is about saving lives and following our doctor's advice and instructions with respect to how we can save those lives and stop this virus from spreading. While the war against COVID-19 is far from over, I know the people of Toronto are getting united in both beating the virus and getting through this crisis together. We're also making progress on initiatives we started in the wake of the pandemic to make sure that we are helping those residents who need help the most. This morning, we opened a new emergency childcare centre, the 5th one that we've opened to help our frontline essential and critical service workers. Toronto is the only city in Ontario that has been able to move quickly to get these centres up and running with the assistance of the Government of Ontario so that we can help our heroes with their childcare needs. These centres are in existing city-run licensed childcare facilities and staffed by City of Toronto childcare workers. And a 6th centre is scheduled to open on the Danforth later this week. More than 200 children are presently in these 24/7 childcare centres, which have rigorous health precautions in place in an effort to respect physical distancing. I commend our staff for working so quickly with our partners at the Province of Ontario to scale up these emergency childcare services for essential and critical service workers and their families. Our efforts on food security are also helping people in our community. We are feeding families in need. The city is working with our student nutrition program partners to support the Food for Kids program, which is sending grocery gift certificates to families of children in need who attend school in Toronto and who were previously enrolled in the school food programs. The $50 food card for these children and each of their siblings represents the approximate value of dozens of healthy breakfasts for each child which they would be receiving if the schools were open. To date, 28,000 children have been invited to participate and to register to receive the gift cards. This is all good progress. For further information on the Food for Kids program, please call 211 or go to tfss.ca. We're also getting food to seniors, responding to the Province of Ontario and Dr. de Villa's recommendation for everyone over the age of 70 to self-isolate because they're part of a more vulnerable population. The city is working with the Red Cross and other partners to provide food hamper delivery to seniors and others in need unable to leave their homes. Since last Monday, the Red Cross has been accepting calls at 1-833-204-9952. That's 1-833-204-9952 for those who might require this service. 376 clients have qualified so far. With support from United Way of Greater Toronto, this service is made available for qualifying clients who do not have access to alternative food services and who are not receiving assistance from another community food program. Finally, we're opening up more food banks. 9 food banks are now open at Toronto Public Library locations in partnership with the North York Harvest Food Bank and the Daily Bread Food Bank. By the end of last week, approximately 2,400 individuals in need have used these new locations. So all of these things we hope will make and are making a difference in these tough times. And this is all possible because the city government is working nonstop with everybody we possibly could work with. People who work in the nonprofits, in the private sector, the province, and the government of Canada, so that we can all together do everything we can to help people. I know after 5 weeks and on a rainy day, a bit gray like today, people feel frustrated and sometimes still scared and maybe just tired of this ongoing emergency. But let me share with you 2 non-government stories of goodness which also offer a hope and a feeling good about our city and demonstrate our values as a caring, supportive city. Last night, I took part in a virtual Easter get-together put on by the Metropolitan Community Church and its Reverend Jeff Rock. Many participants spoke of their gratitude for the support being offered by our city and by our province and by our country, not necessarily to them, but to people in the city who are people in need. But it was 2 men, both named Jim, who have lived together for 55 years, who really surfaced the story of our city during COVID-19. And they said that since the isolation period began some time ago now, they've had almost 20 visits, mostly from strangers, who knocked on their door. And sometimes they just knocked on their door to see how they were doing, not even people they knew. Other times they came bearing a gift of wine, a bottle of wine, which I'm sure would be most welcome by many at this point in time, or some food. You couldn't help but to be moved both by this generosity of spirit of the people who knocked on the door, but also the reaction of these 2 seniors who so much appreciated the caring and concern of so many of their fellow citizens, many unknown to them. That is our Toronto. Similarly, another story comes from a call to my office from a resident named Colleen. Colleen left a voicemail and wanted to let us know about an act of kindness from a young person. She called multiple grocery stores over several weeks to see if they had any carnation milk in stock. Most stores informed her they did not have any in stock, but even when she asked if they did have some, would they set it aside on hold for her so she could pick it up, they said no, they wouldn't. She called a Food Basics at the Westford Shopping Centre in Scarborough. So congrats to them, because the night supervisor there at the Food Basics, a woman by the name of Rose, not only offered to set some carnation milk aside for Colleen, but at the end of her late shift, late in the evening, she took a case of carnation milk to Colleen's house. She delivered it, a service not offered by that particular store. And even while dropping the items off, Rose kept her distance, her physical distance from Colleen, and offered an air hug to Colleen as a part of delivering this carnation milk to her. Colleen described Rose as a very petite young woman who would not have had an easy time carrying a case of carnation milk all this distance, but she did it anyway. And that too is our Toronto. So these are stories of hope. These are stories of feel-good stories that tell you how people in Toronto are reacting to difficult circumstances during the crisis and during the period of isolation that has been imposed to some extent by all of the orders and recommendations that we've received. But we are making progress. We're making progress in this regard and in helping people through government programs, but also in fighting the virus itself. More and more people are doing the right thing and staying home. More and more people are following the requests we've made of them in terms of how they behave in public places. And this will keep more people healthy, and it will save more lives and protect our healthcare system. So we're looking after each other, and we're supporting each other as Torontonians do. We're focused on caring for people now, but I want to offer further hope by telling you we're also planning for the day that will come when we will begin to get ourselves back to normal. And I'm sure it will be a gradual process, but we're making plans for that just so that you know that we are, because I think that too should give you a sense of hope. And I'm sure that when that day comes, or those days come over a period of time, we'll emerge stronger than ever. So I thank you for all of the cooperation and all of the assistance and support that you're offering to each other. And we'll call on our Medical Officer of Health, Dr. Eileen de Villa, to give her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. As of 12:30 this afternoon, there are 2,362 cases of COVID-19 in Toronto. This includes 2,088 confirmed cases and 274 probable cases. There are 210 people hospitalized and 80 in intensive care units. In total, 92 people have died of COVID-19 in our community. I continue to receive questions about the status of COVID-19 in our city's long-term care homes and the shelter system. As of 12:30 this afternoon, there were 39 long-term care homes with one or more COVID-19 cases. I'm sad to share that there have also been 50 COVID-19 deaths in these homes. As you can appreciate, I am very concerned about these outbreaks in long-term care homes and the devastating impact they have on our parents, our grandparents, and our loved ones. We know that any infectious disease can spread faster in congregate settings like long-term care homes. And these settings are especially concerning because residents are generally older and more vulnerable to infection due to compromised immune systems or other chronic health issues. I also wanted to share, on a more positive front, that we are starting to see that our stringent outbreak control measures are starting to have a positive effect. In long-term care homes that had a high number of cases, the rate of new infections is slowing. I want to recognize the tremendous effort these outbreak measures involve. Hundreds of staff across all our long-term care homes are working together tirelessly and are committed to protecting and caring for our loved ones in those settings. The other vulnerable community that we are concerned about are those experiencing homelessness. Currently, in Toronto's shelter system, as of 12:30 this afternoon, there are 25 confirmed COVID-19 cases amongst clients. I will be providing a more comprehensive update tomorrow on our local situation in this setting. As you know, all of these numbers are constantly changing as our local situation evolves. My team continues to actively follow up on all of these situations. The people who are ill and those who have died in our community as a result of COVID-19 are not just numbers. They are our neighbors. and they are our loved ones. These tragic losses have devastating impacts on our community, and I know you join me as I extend my sincerest condolences to the families and friends of all individuals who have died from COVID-19 in our city. And for those who are ill, I wish them a speedy recovery. I recognize that these numbers are unsettling. It is difficult, truly difficult, to witness the increasing impact of COVID-19 on our community, particularly on our city's most vulnerable. We know that COVID-19 continues to circulate in Toronto. Currently, approximately 30% of our cases are the result of community spread. This is why it is so important to stay home as much as you can. This is the only way we will reduce the spread of this virus in our city. This is not the time to relax our approach or our commitment to physical distancing. We believe the number of COVID-19 cases will continue to climb in the coming weeks. I've been asked why we are seeing more COVID-19 cases in our city after many weeks of physical distancing measures. As I've described before, the virus has an incubation period of up to 14 days. This means that if you are exposed to the virus and infected today, you may not know for as long as 2 weeks. This is why I continue to remind everybody to please stay home. The measures that have been put into place to protect our community take time to have their effect. They take time to work. Lastly, I would like to sincerely thank everyone who connected with family and friends in creative and responsible ways over this past long weekend. I've heard of virtual family dinners and gatherings, and members of our community reaching out by phone to others who are isolated at this time. This is important and as valuable a support as picking up groceries for a neighbor in need. We are all looking forward to when we can look back on this time as a distant memory. However, we are not yet at that moment, and we all have an important role to play in protecting our community. So please, continue to stay home, stay safe, and take care of each other. I'll now turn it over to Chief Pegg.
Thank you, Dr. de Villa, and good afternoon. Today I will provide an update on the status of operations within our Emergency Operations Centre, as well as an update on emergency first response across Toronto. Our Emergency Operations Centre continues to be fully activated and is operating at level 3, which is our highest level of activation. There are representatives from each city division and agency engaged in the EOC, and all aspects of COVID-19 planning and response are being coordinated effectively. The COVID-19 Planning Task Force, which forms part of our overall incident management system structure, is focused on the following areas: citywide business continuity, staff redeployment and labor availability planning, and the sustainability of city service delivery. Under the leadership of the City Manager's Office, we are significantly expanding the focus and resource allocation within the EOC dedicated to the social and economic recovery in Toronto. This is important work that is focused entirely on restarting the economy and returning the city as best as possible to a state of normal once COVID-19 is behind us. Other key areas of focus within the EOC include the comprehensive management of personal protective equipment, social services planning and operations, and of course, the uninterrupted delivery of essential and critical services, including emergency services. I will provide a more detailed update on personal protective equipment later this week. The provision of emergency services in Toronto continues without interruption and without any reduction in frontline emergency service levels. With respect to paramedic services, emergency medical call volumes are down approximately 8% year to date, as compared to the same time last year. In general, lower acuity call volumes are down, while higher acuity call volumes remain stable. Both frontline paramedic service levels and on-duty staffing levels are both stable and consistent. Our residents continue to receive world-class emergency pre-hospital care and paramedic service in Toronto each day. With respect to fire services, emergency call volumes are up 4.3% year to date as compared to the same time last year. Most significantly, the number of working fires are up 17.6% year to date as compared to the same time last year. The two leading causes of fire in Toronto are careless and unattended cooking and careless smoking. In response to these alarming trends, Toronto Fire Services is running daily public education campaigns aimed at reducing the number of fires caused by cooking and smoking. Please, never leave your cooking unattended, and please ensure that you safely dispose of cigarette butts and other smokers' articles. Service levels and on-duty staffing levels within fire service are both stable and consistent. With respect to policing in Toronto, the Toronto Police Service continues to focus on community safety, investigating crimes, and responding to high-priority calls. There has been no change to frontline policing in our city. Toronto Police continues to enforce the law and is adapting to the current impacts of the COVID-19 pandemic on the city. Toronto Police continues to increase patrols and are increasing the visibility of officers across the city. With the escalation of the COVID-19 pandemic, Toronto Police are experiencing an overall decrease in the number of calls for service. This is generally attributed to the reduced number of people working in the city, reductions in the number of people traveling in and out of the city during the day, and fewer people calling 911 to report the same incident. Our police officers continue to respond to both the current and changing dynamic of the city and continue to educate, enforce, and work hard to keep our communities safe. In summary, we are truly fortunate to enjoy the levels of expertise, dedication, and service that our emergency responders provide each day in Toronto. I extend my sincere thanks for everything that each paramedic, police officer, and firefighter does each day in service to our residents. In closing, I would like to acknowledge that today marks the start of 911 Telecommunicators Week. The dedicated men and women who answer and process incoming 911 and other emergency calls for help are on the very front lines of emergency response. These are the people who answer the very first call for help when someone is having their very worst day. These professionals receive, process, and dispatch these emergency calls, often in less than 60 seconds, and often under extreme stress and pressure. On behalf of all of us, I extend my sincere thanks for all that each emergency call taker and dispatcher does every day. You make us all very proud. In closing, I also want to acknowledge and thank every resident, business owner, and everyone in our city who is impacted as we do our very best to stop the spread of COVID-19. We are truly all in this together. I remind everyone that the city's website continues to be updated hourly with new and revised information, and I encourage you to check back regularly at toronto.ca/COVID-19. Thank you.
Thank you, Chief Pegg. Go to our first question. Reminder to reporters on the line to please limit to 2 questions. There's a number of you on today. First up is Austin Delaney from CTV. Austin, go ahead.
Hello, Mr. Mayor. I was wondering if today you mentioned on CP24 that you might want to make the sidewalks one way, and you were going to take that to the emergency operations today. What came out of that?
Well, it was part of a general discussion about ways in which we could make sure that the sidewalks don't become congested so that we can both have people keep moving but also moving safely within the context of the physical distancing. And I will just say that I think a good summary of the health and medical advice that I'm receiving and that has been put into the hands of some researchers that wrote to us about this is in a letter from the medical officer of health, who is not recommending at this time that we undertake any of these measures, but rather we will continue to rely on people to accommodate each other, which I think they're doing, and they're keeping each other safe within the context of what's something that she may wish to comment on, which is the risk level or lack thereof from people simply passing each other on the sidewalk. We are both, all of us, concerned about the safety of residents everywhere, whether it be anywhere they are, parks or on sidewalks for that matter, and their safety vis-a-vis healthcare, but also vis-a-vis traffic and other such things. But I think at the moment what we're doing is we're focusing on following the advice of the Chief Medical Officer of Health, not closing our minds to any options that might arise at some point in the future. And in fact, we've invited some of the people that are interested in this and have communicated with us to indicate to us if there are areas of the city that have a particular problem with sidewalk congestion, so that we can factor that into our thinking on this. In my own case today, as part of keeping people safe, I was focused on helping the homeless, as you've heard referred to by Dr. de Villa, on the city's finances, which are going to be important to allow us to continue to provide services to people, on questions related to long-term care and a host of other things like that. And that's not to say this one didn't receive some degree of consideration, but at the moment we're not planning to do anything to make sidewalks one way, or for that matter at the moment to close streets.
By way of a follow-up, Dr. de Villa, what is the risk of catching this virus on the sidewalks?
So thanks for the question. If I can follow up on what the mayor has already indicated, at this point in time, when we're always focused on the safety of our residents. That applies certainly within the context of this emergency, but that applies at all times. In the context of the current COVID-19 emergency, the most important thing that people can do in terms of protecting their own safety and the safety of our community is to stay home as much as possible. So, my hope is that sidewalk congestion should not be a significant issue at this time if in fact people are following the advice to stay home as much as possible and to go out only for those essentials on an as-needed basis and as infrequently as possible. When we look at the infectious disease in question here, though, COVID-19, we've talked about how it's transmitted, and it is transmitted through direct close contact with individuals who are infected. And you have to have close contact with their respiratory secretions or droplets that come out of their nose and mouth when they're coughing, sneezing, most notably, things like that, and or speaking. So, the risk when you actually pass somebody in an open air environment, and if it's quick, is considered low. We can't say zero. There is no such thing as an absolute zero, but it is a very low risk. The most important thing, however, is to stay home as much as possible, and to only go out for those essentials.
May I add just one more thing, and that is that I have relied throughout this entire crisis period on the advice of the Medical Officer of Health. I will continue to do so, and if her advice changes, and we discuss these kinds of things on a frequent basis, and we've said that to those who have been communicating with us about this, we're not saying no to anything. We're saying not now in the context of both health advice, but also in the context of the many things we're trying to do to help people and keep them safe. But I rely on her advice and will continue to do so.
Okay, thank you. We next go to Brian Passafium from the Toronto Sun. Brian, go ahead.
Good afternoon, everybody. Do you have any update on the situation at Willowdale Welcome Center? At last report, I believe there were 4 confirmed cases there. Is there any update on how things there after the weekend?
Brian, I'm just going to have Marianne Bedard come to the table. Just give us a moment, please.
Thank you.
Hello, Brian. Yes, so we do have confirmed cases at Willowdale Welcome Center. Last I heard, there were 4 confirmed cases. Toronto Public Health is on site, working very collaboratively with our agency partner at that site. We are following all of their advice. There is physical distancing at that location. We have been able to provide that at that location with the people that are currently there.
Okay, thanks. And my other question was to do with more detailed stuff about the long-term care situation, but Dr. de Villa, you said you were going to go into more detail about that tomorrow. Do we have, is there a breakdown available on how many deaths and cases there are in individual homes? Would that be made available?
So Brian, what I have for you right now, as I mentioned today, as of 12:30 this afternoon, we have 39 long-term care homes with one or more COVID-19 cases. And at that time as well, there were 50 COVID-19 deaths amongst those homes. I can certainly get back to you with respect to the individual home details, but as I've also mentioned in my remarks, we can expect to see these numbers continue to change. There are ill individuals within those homes, and I think we should expect to see cases and deaths. However, I also did point out in today's remarks, and I think this is important, that the outbreak control measures that have been put into place into those settings where there have been outbreaks, we are starting to see the impact of those control measures and seeing a slowing rate of infections, which is a good thing and is truly a testament to the amazing work that is done by those in the long-term care settings. They are working incredibly hard, and it is very difficult to do within those congregate settings, but they are working extremely hard to put outbreak control measures in place and to do the best they can to protect and care for the residents in those long-term care homes.
Okay,
Thank you very much.
We'll go to Matt Bingley now from Global News. Matt, go ahead.
Hi, my question's in regards to the mandatory quarantines for people coming back to Canada. I was speaking with someone who has witnessed someone who has recently returned from Florida who is going out and not really paying attention to the mandatory quarantine, and as part of that has been really sort of being led to a loop of who she should actually be reporting to. It 311 says call the COVID hotline, they say call non-emergency police, and they say call 311. So who really is in charge of checking in on these people?
So with respect to those who are returning travelers from elsewhere, first of all, I'm terribly sorry to hear that there is an individual who doesn't appear to be taking this situation as seriously as we would like them to. This is a matter of protecting, our friends and our families and our community. And one would think that, the benefit of our community and the benefit of our neighbors and families would be reason enough to follow the advice and the recommendations that are put out there for good reason. With respect to those orders, though, with returning travelers, those are under the purview of the federal government. That order was issued under the Quarantine Act. It is a federal act, and it is one which our federal public health partners are responsible for. So they are the enforcement agency, if you will, for orders that they issue under their legislation. However, as we've said many times at this table, in public health or in any realm of, I think, governance, you try not to go to enforcement where you don't have to. We hope that people understand the circumstances that we see here in our city and will act based on their interest in protecting themselves, their families, and our community as a whole.
But if I could just follow up and ask, if this is clearly somebody who doesn't care or does not know, it's not like you can just call up Ottawa and say, can you come and tell this person to stay inside? So who should this woman be calling to actually make sure that this is actually being enforced?
Well, I would suggest for now, I think if there is an opportunity for individuals to have conversation with that person to say that actually there's a reason why these measures are in place and get them to do so voluntarily, that would be the first best option. However, as we've heard at this table before, certainly calling 311 we'll ask them to put it through to us at Toronto Public Health, and we can connect with our federal partners if we have some sense of identifying who the individual is, and we can get our federal partners to follow up on their own order, as it is within their purview to enforce their orders under their act.
Okay, we'll go to Talia Ricci from the CBC. Talia, go ahead.
My first question is around the city's shelter system. There was a letter that was sent to the city today, signed by over 300 Toronto physicians and nurse practitioners, calling for a faster response to ensure physical distancing is happening in shelters. I know you mentioned this is happening at Willowdale, but they're asking in part for this to happen by accessing more hotels. So I'm wondering if you've had the chance to review this letter. I know it was sent later in the afternoon, and what's being done to continue to ensure that Toronto's homeless shelters and refugee shelters are equipped to handle outbreaks.
Thank you for the question, Talia. Actually, yes, I did get a chance to review that letter and concur with much of what they're asking for, and many of those things are in fact in place. We have been proactively asking our provincial partners for priority testing for individuals who are homeless, and also proactive testing as well to help us understand how this virus is moving through the shelter system. We have also been working incredibly hard with our community partners across the sector to move people to create opportunities for social distancing. I can tell you that we've been successful in moving over 1,000 people so far, which is a significant amount of movement to create in the shelter system. And we will continue those efforts until we are able to create that physical distancing right across the sector. In the meantime, we are working with our partners in the sector. We are promoting screening, physical distancing as you can, different ways to orient your space to increase the opportunity for that, staggering meal times, limiting the amount of people in recreation spaces, a variety of different tactics that people can use until we're able to achieve that number.
And my second question, I know, Dr. de Villa, you said that we were going to go into more specifics in terms of the long-term care homes tomorrow, but my colleague Mike Crawley is working on a story specifically about Eatonville Care Center in Etobicoke, where the families of 3 different residents have told us that they were informed there's been 14 deaths. We're wondering if you could offer any kind of explanation on why that center went so quickly from no deaths and only a few reported cases to 14.
So just to be clear, in my remarks, I mentioned how we were going to be discussing or going into further details with respect to that which is happening amongst those experiencing homelessness. And I'm afraid I don't have the specific details with me now on the long-term care home you're speaking of at Eatonville. Happy to discuss that with you offline once I can get some details on that. But we do know that within long-term care homes, as I've mentioned, these are very challenging environments for any infectious disease outbreak, including COVID-19. We know that residents within these settings do tend to be older adults and are often more susceptible to infectious diseases like COVID-19 because they're older, because they have pre-existing health conditions, and or have compromised immune systems that make it more difficult for them to fight off infectious diseases. However, there are very stringent outbreak control processes and practices in place. And we work with all of our long-term care homes to ensure that when they find themselves in situations of outbreak, that they are implementing as quickly and as effectively as possible the range of measures in order to mitigate and minimize the impact of infectious disease on the residents and on the staff working in those homes.
Okay, thank you. We'll go to Mark McAllister now from City News. Mark, go ahead.
I'd love to be able to follow up on that question as well. You have said a few times now that in the long-term care facilities, that rate of new infection is slowing. However, we are talking about a number of different facilities now where these numbers are continuing to increase dramatically in a very short amount of time. So how can you say that the rate of new infection is slowing when it's seemingly skyrocketing at the same time?
So, Mark, to be clear, what I've said is that in long-term care homes where we've seen a high number of cases, when outbreak control measures are put into place, that's where we're seeing the rate of new infections slowing. So that's the situation I'm describing. I know that the long-term care sector is working very hard to try to prevent the introduction of COVID-19 or any other infectious disease agent into their settings. This is an important area of concern at all times within the long-term care setting. And they do have a number of different infection prevention and control procedures that are in place at all times. And then when cases of infectious disease are identified, there are even more stringent measures put into place in order to control the outbreak. We know that we're working with our long-term care partners to facilitate access to testing as well. So there are a broad range of measures, everything from enhanced cleaning to screening of residents and staff on a daily basis, to very quick identification of those who are believed to have symptoms of COVID-19 or believed to have an infection of some kind, so that all the control measures can be put in place as quickly as possible. But the circumstances vary from home to home. Some homes are older than others. Some of the physical layouts in some of the homes make it sometimes more difficult for infectious diseases to be controlled. And of course, with an older population which has chronic health conditions, they are in fact more susceptible to COVID-19. And when we look broadly around the world at who is most impacted by COVID-19 and who tends to get sick and have more severe outcomes associated with COVID-19, we know that it is an older population. And this is exactly the population that we see within the context of our long-term care homes.
Thank you.
Do you have a follow-up, Mark?
Good. Thank you.
No. Okay, go to Jennifer Pagliaro now from the Toronto Star. Jen, go ahead.
Hey there, for Dr. de Villa, I'm wondering if you could speak to the fact that the Works, the city's supervised injection site, as I understand it, is still closed, and what the plan is to get it reopened.
So yes, unfortunately, the supervised consumption service that we provide at Toronto Public Health is currently closed, and there have been a number of efforts made by the team at Toronto Public Health to think about how we provide that life-saving service to the clients who benefit from that service and who need that service. Unfortunately, right now, the circumstances outside of the physical location where the Works is located makes it very, very challenging to achieve appropriate physical distancing and to ensure the safety of clients and the staff of the service. So I know that the team is actually working quite hard with other partners throughout the city to try to figure out, and community partners, I should say as well, to figure out how best can we offer the service, what different methods might we consider in order to ensure that these very important life-saving services, supervised consumption services, and the other associated harm reduction services are made available to those who would actually benefit and who need those services. It is a very important question to us, and one that we will not stop looking at until we figure something out.
Okay, thank you. And just on another topic again for you, Dr. de Villa, I'm wondering with respect to your orders and the directions and recommendations you've given for healthcare workers, specifically in hospital settings. Obviously, they're desperately needed in these times, but for those who are testing positive but are asymptomatic, what is the direction for those people? Are they to stay home if asymptomatic but tested positive?
So with my order, what we're trying to do is to, as much as possible, ensure that those who are positive or suspected of having COVID-19 or at high risk of having COVID-19 are meant to stay at home as much as possible. We are trying to isolate them such that we reduce the likelihood of virus transmission. I think with any circumstance, though, there are often unique situations where risks and benefits have to be looked at, and each individual situation certain individual situations may need very specific assessment. I think that what we're trying to do is create the circumstance that actually allows for the greatest health in the community, that has the most positive impact, while of course minimizing or mitigating any negative impact. And so I think when it comes to the issue around healthcare workers in particular, one has to think about the necessity of the service that they're providing, the uniqueness of the service that they're providing, and then take that into consideration in terms of what is the best course of action. So I would say by and large, those who are positive for COVID-19, those who are suspected of having COVID-19 infection, they should absolutely be in isolation in order to limit virus transmission in our city. There may be unique circumstances where the calculation looks different, but those are very unique circumstances, and those situations would have to be examined very carefully.
Okay, thank you. We'll go to James Moore now from News Talk 1010. Go ahead, James.
Hi, good afternoon. Could we just hear from Chief Pegg, please, about some of the reasons why, maybe some insight into why some of those calls, and you mentioned calls for fire, up almost 20% compared to this time last year. Is there anything you could tell us about what's going on to cause that spike in calls?
Sure, thank you. So all indications are that, like I said, the principal cause of those fires has not changed from what we see on any given year and across our city under normal circumstances, and that is unattended cooking and careless smoking. So all indications from our investigations team is that the spike we're seeing is generally the result of more people being at home, and of course more people cooking in their home, and just by virtue of the fact that we're home more than we normally are, things like smoking are happening on a more frequent basis. So we're not seeing changes in the origin and cause data. It's really just a higher volume, and that's specifically why my colleagues at Fire Services have embarked upon now daily public education campaigns to do all that we can do to remind people never to leave their cooking unattended. If you're cooking anything, you need to be with it at all times, and to make sure that if you choose to smoke in your home, that you are being extremely careful with respect to cigarette butts and smokers' articles and things like open flame. So all indications are those are the two leading causes, and of course we're doing everything we can do to drive those numbers down.
And this would be for the mayor. Do you anticipate at any point, because we know that so many more people are applying for federal assistance through the pandemic, do you expect to be involved in any way with food banks as demand increases, not only in terms of distributing food to people, but also actually getting food in for them to distribute? Because we're hearing a lot of stories, at least anecdotally, about how long waits can be to actually just get into grocery stores, and in some cases items are scarce depending on where people are shopping.
Well, we continue to monitor this situation, and I'm heartened by the fact that we have opened just last week more than half a dozen new food bank, I'll call them satellite locations, in public libraries, that the food bank organizations, the nonprofit organizations, are doing an excellent job, I think, making up for what has been a shortage of volunteers that they have experienced because of the COVID-19 situation. And as well, we have put into place, with the help of people like the Red Cross, brand new programs like food delivery for seniors. So these are the kinds of things that we talk about every day in our emergency meetings that we have. And as we hear back from the community, and that's the good news on this, is we have such a network out there across 14 different tables. As we hear back about hotspots where people are not getting food, or where there are lineups or lack of supply at the food banks, we have the ability to move on that and to get additional donations, which we've had from the corporate sector, and to call on the public, which I do today again, to drop off any non-perishable food items at fire stations, for example, or at the Daily Bread Food Bank.
Okay, thank you. We'll go to Jeff Gray now from the Globe and Mail. Jeff, go ahead.
Hi, thank you. I wanted to ask about the total number of homeless people that we think have COVID-19. The number, I think, was 25. Does that number include the number 4 for the tally at the refugee center? Because I've been told that number is actually much higher. It's actually 11 people now. And can I get some clarity on why there'd be a time lag in the numbers here?
So I can confirm we had the information from Public Health this afternoon that there are 25 confirmed cases in the shelter system. I don't have the exact details to know whether or not it's 4 or 10 at that particular site. I can certainly follow up and let you know. But we do get our numbers confirmed from Public Health on a daily basis. So they receive the results of the tests and then they share that with both the individual and also with us. And so the number is 25.
And as a related follow-up then, can I ask about the plans for a recovery center, a 400-bed recovery center that's going to open for homeless people who have COVID-19, and I understand it will use the expertise of Doctors Without Borders. Could you talk a bit about why, first, when that facility is supposed to open and why we need Doctors Without Borders there?
So I think it's really important in a time like this that we look across the spectrum at all kinds of partners. We've had a really great partnership with healthcare providers, and I think this is just another organization that is identifying that this is a very vulnerable population and that they would like to do their part to join us and our local healthcare partners in providing a really needed service. And so we continue to work on activating that site. And hopefully in the very near future, and we can let you know that that in fact has happened.
Okay, thank you. We go to Beth McDonnell now from CTV.
Hi there, Dr. de Villa. Can you please talk about the situation at Seven Oaks? This is the largest outbreak in a long-term care home in the city. And can anything else be done to lower the rates and deaths there?
So I think I'm being joined by Paul Raftis from Senior Services and Long-Term Care. But before he gets himself settled in the chair, I will say that our team at Toronto Public Health has been working virtually around the clock with our colleagues at Seven Oaks. We've spoken about Seven Oaks at a number of these press briefings and spoken about the many initiatives and outbreak control measures that have been put into place at Seven Oaks after identifying the outbreak situation. Enhanced cleaning, active screening, ensuring that those who are identified are quickly isolated as much as possible, and you know, just making sure that all the activities and physical distancing where possible, all the personal protective equipment, these are all important measures to take and outbreak control measures that are put into place when an outbreak is identified in a home. I'll turn it over to Paul to speak specifically to the latest on Seven Oaks, though.
Thank you, Dr. de Villa. So I would just add to that since January, Dr. de Villa's team and our team have been working together. We did set up a COVID, actually at the time it was called a coronavirus working group to ensure that we were absolutely prepared for this virus. We found that it is exceptionally difficult to fight, and the Seven Oaks started very early on. And so immediately we implemented all of those outbreak measures. We've been working around the clock, our team, and daily with Dr. de Villa's team to do everything possible to reduce the spread of COVID-19. And of course, our deepest condolences go out to the families of those who have passed away. We are hearing regularly in the industry about staffing and staffing being an issue. In the city, we have coordinated amongst our 10 long-term care homes. We're working exceptionally hard to make sure that all staffing is available. We've moved our management team, all available management staff, to assist with these responses. We've maximized overtime. We've maximized all of our available staff. And again, looking at any and all options to make sure that we were responding on an hour by hour to make sure that we're taking care of these very serious outbreaks in the homes.
Do you have a follow-up, Beth?
To that, yes, just a follow-up to that. So can you confirm that healthcare workers are no longer going to other facilities? Like in the response, it sounds like it's being limited and restricted, but can you say that the workers at Seven Oaks are not working at other facilities?
So thank you for the question. So through the entire healthcare system, this is a significant issue. At the city, we have spoken to all of our staff, including at Seven Oaks, and we've expressed that we want them to work for us exclusively. We've offered full-time hours for all of our part-time staff to make sure that they could work a maximum number of hours. But of course, outside of their hours of work, it's not something that we have the ability to control, but we've done our very best to make sure and to provide the opportunity for staff to work exclusively for the city.
Okay, thank you. Last question now to Francine Copeland from the Toronto Star. Francine, go ahead.
Oh, hi there. I'm following up on the 35 confirmed cases amongst clients in Toronto shelters. How many shelters are involved?
Mary Ann's just coming to the table, Francine. I believe that number is 25.
Okay,
by
thanks.
the way, 25.
25 cases, but how many shelters?
Hi. Yes, to confirm, there are 25 cases, and they have happened in 7 separate locations.
And have there been any deaths?
No, not that I'm aware of.
And do we know how many are in ICU?
That's health information that we're actually not privy to. So unfortunately, I don't have that information for you.
Okay, thanks.
Okay, thank you very much, everybody. We will talk to you again tomorrow at this time.